So we are live again from First Line in Health 2025, a new episode of PLS, Leaders of PLS podcast. Very happy to have with me Abhi Kalra.
Thank you. Thank you for the invite. Happy to be here.
Super happy to have you. You are Executive Vice President of Connected Care at Canada Health Infoway. So first and foremost, tell us about Connected Care and how are digital health solutions, to your opinion, transforming the front line of healthcare in Canada?
So when we think of our public health system, there are three main actors. One is patients like ourselves. Second are the various healthcare providers, who do just a fantastic job in providing care. And the third is the health system itself, the health administrators, right? Who need to actually, the public health surveillance, who need to keep an eye on, as an example, what could be the next pandemic or epidemic, right? So keeping an eye on that.
Okay.
And also health system, that takes the knowledge and the information for research and everything. So these are three important actors of a system. Now think of it as a patient. You have your information sitting in pharmacies where you fill your prescriptions.
Right. Yep.
You go to your primary care doctor or walk-in doctor,
Yep.
right? So your doctor has your information. And God forbids, if you have to go to a hospital, your hospital has some information about
Supposed to, yes.
Yes, hospital will have some information. And if you have, let's say, an aging parent, who are being to long-term care, there's some information sitting there. So these are all different, health settings where
Lots
your
of
health
places
information is
with
sitting.
my personal information.
Right?
Yeah.
And it would be really useful if all of this information comes together and Christine can actually say, oh, this is my complete health record, right? So you're suddenly empowered. And how do you enable that? Through connected care, right?
Oh, I love it. Yeah,
That's
it makes a lot of
connected
sense. Yeah.
Right? From a healthcare provider standpoint, so that's actor number one. From a healthcare provider standpoint, when you go and seek care, whether to a walk-in clinic or to a pharmacy or to a hospital, the frontline staff, the triage people, they would want to see your complete health information to provide quality and safe care and effective care. Because otherwise they'll have to rely on the information that you give them at the time of care. And you may or may not be in a condition to describe, what allergies you have, what was the last vaccination you took, what was the medication you took, right? So that information is available in the system. So imagine if that's a connected health system, the triage person will have full view of your health record and be able to provide safe quality care. So that's connected care. Now third actor, which is the health system, the public health officers. When you talk about new drug research or a new drug that is required for any disease, how do you actually do that research? How do you actually make sure that you're successful in doing that? You need to collect some information, historical information about aggregated information, not an identified information, but an aggregated, anonymized information for the population on the whole, to be able to actually do a faster drug discovery. So you see each of these three actors, how do you enable that? Through connected care. That's connected care.
So connected care is really at the center of all these solutions, improving the first line
It's
services.
a principle.
Yeah.
It's a principle, it's a discipline, it's a strategy, it's a framework, you can call anything. But you're bringing all these digital assets together because if we have moved away from a pen and paper system. Everything is digital these days. But how do you connect all these digital assets? And that's connected care.
And we are in an evolutive, transformative state right now. We've always been, I feel, but right now is, we feel it a little more. Lots of changes are happening or need to happen to improve patient care, for example. So what are the key ingredients for a successful digital transition? Or how do you make it happen at Infoway and Connected Care?
So first and foremost, we have to recognize we have a wonderful country which has 13 provincial and territorial health systems, plus then is a federal health system, right, for the federal population. So we have to respect and recognize that, right? So the way to do this is at Infoway, we work with all of these stakeholders, plus the private sector, to drive common priorities, to drive common strategies, to drive common standards. Because through that, what you do is you bring consistency. even though we have different health systems, but how do you bring consistency in every single health system, right? Which means how do you actually drive consistency across connected care in every single province and territory that you work with?
It's a big challenge.
It's a bit challenging. So what does it require? It really requires coordinating with all of them, bring them to the table, aligning them, making sure that they align to those common principles, common priorities, common blueprints, common standards, right? Common way of doing things, right? As an example, a patient access to their health record strategy should be common across all regions instead of trying to figure out on your own, right? So Infoway does strive very hard to make sure that we bring that pan-Canadian approach, right? But respecting the fact that the autonomy of the health system still sits with each of the region.
And they have their own way of doing things, and
that's the only way you bring efficiency in the healthcare system, and you bring consistency in the healthcare delivery across the region.
So I'm hearing a lot of communication is the main component of a successful digital transition, or there's a big part of it that's communication.
Yes. Communication, collaboration, and mobilization. So that's with the provinces and territories. But on the other side, the private sector, like you see all the private companies here as well, they want to see consistency. They don't want to go to each region and do things different times. They would be a lot more cost effective. Their solutions would be a lot more cost effective, right?
I was going to say,
if they all have, a common expectation from all the 13 regions. So that's also a very important part of the work that we do.
We're talking business. We're talking numbers as well. You work a lot with data, right? On a day-to-day basis. Your decisions must usually be data-driven.
Yes.
Now, how do you ensure these are all mainly, most and for all, human-centered, or that they remain human-centered?
The voice of the patient and the stats that we collect, facts are facts, and I think numbers never lie.
Yeah.
Right? So that really guides, where do we need to prioritize some goals. So for example, when we did the last survey, we know 9 out of the 10 Canadians want to have access to their electronic health record. That's a very, very compelling stats.
Yeah.
Right? So how could you ignore that and not make that as a priority?
No, this is like humans speaking.
Right.
So
I want it.
Yeah.
I had an unfortunate event last week where I had to present myself in an emergency room.
Okay.
And I know I had to repeat my information, my allergies, my medication, my vaccination, my last visit to the doctor, my last diagnostic results to the triage nurse, to the visiting doctor, to the ER doctor, and to the surgeon. Same information repeated 4 times. Right? So think about it, which is why I think it's important. But if I was able to actually carry my health record on my phone, on my mobile device, that summary, I could actually share that summary.
So that's the goal.
That they can actually review, right? So to me, these are the stats, these are the numbers, the voice of the patient that pretty much defines how do we prioritize our work.
So human experience.
Yes.
Okay, now a little more. I don't know. It could be personal, a little bit more personal. What do you like the most about your job? What drives you every day?
Yeah, I think working in the public sector, the mission every day when you get up and you have a singular mission that you want to improve the public health system. You want to improve it for the Canadians.
It's like a mission.
Yes,
it's
you want to make sure that every Canadian has a better experience of our health system, right? You want to make sure that every Canadian is proud of our health system, and that's the mission that we have. And I think we have a very specific goal of enabling and advancing the digital health and connected care in the country. Right? Because we know that will improve the experience, we know that will improve the outcomes, we know that will improve the cost efficiencies, across the country as well. So that is that singular mission, that I and my team, pretty much, wake up every morning to go raring at it. Yeah.
Did you always want to do that?
My initial background was in finance. I spent time in finance, but after I had my first experience in healthcare space about 10 years back, I was so fascinated, one with the gaps and the problems that we need to solve, but the other, the potential of the work that we could do in the healthcare space, and the potential of the problems that we could solve. That was really fascinating, and I've never left public sector then. So it's now been 7-8 years in this space.
You've worked in different countries.
Yes, I worked in many countries actually.
How would you say, or how would you compare the state of healthcare today in Canada to other places you worked?
Yeah, so again, I believe in facts and stats. So I was reading the latest OECD survey and their numbers across the Commonwealth countries. So Canada is somewhere stacked in between, right? If you look at a number of countries, there are some countries definitely, which are better than them. But I think, and then there's certain countries, that are doing poorly compared to Canada. So I would say, Canada is somewhere in the middle. And I think a lot of this is also driven by the nature of the health system. Like Canada is 100% public health system, but we have 13 different health systems, right?
Yeah.
If you look across US is a combination of public plus private sector system, right? And if you look at Denmark, they have a single health system, but it's with 5 million population, right? So there are various factors and various constraints, that come into the play when
And
you
we need to
start
consider
compare
all
that.
these factors.
So it's really hard to do an apples to apple comparison, when it comes to the country. But I would say, based on the studies and the surveys that we have and the stats that we have, Canada is ranked, I would say, somewhere in the middle.
Because I was my other question, a sub question was, do you think we're being a little dramatic? Because you have a vision of other places in the world, or you have, so here, I'm not going to talk about all the problems, but we're talking a lot about problems, and here we want to find solutions, right? So do you think we're being a little dramatic in the way we speak about healthcare system in Canada?
So your question is saying, do we think we'll actually go up in those rankings?
Yeah.
I think every leader in the healthcare in Canada actually aspires to be on the top. I mean that's good. I mean there's that hunger, there's that passion. In every single healthcare leader in the public sector, right? Is to really improve our health system and take Canadian health system to the top. But I will tell you the challenges that we face in the healthcare system in Canada are no different than the other countries are actually facing. I'm privileged to represent Canada at the Global Digital Health Partnership conferences, the summit, which has delegates from about 40 countries. And when we talk about our problems and our challenges, it resonates because every single country actually has similar challenges that they're going through it.
Thank you, Abhi.
Yes.
Are you ready for the fun part?
Right,
I've got some questions for you,
Okay,
rapid fire
let's do it.
questions, just to get to know you better. So, laptop or notebook? What do you use the most on your day-to-day?
Laptop.
Okay. Do you write at all, or are you mostly?
I write.
Okay,
I
you
write
write
a
a
lot.
lot. Okay, on the laptop or with?
On the laptop
pen-
and on my notebook
pen and
as
paper?
well.
Oh,
On my
no,
notebook
okay.
as well. Yes.
Are you a morning person or night owl?
Actually, it's both. I get up early and I go late. So
Do you nap in the middle or?
No, I don't.
Okay, so
I
you
don't.
just don't sleep a lot.
no, I don't sleep a lot. I sleep 5
Okay.
to 6 hours. Yes, that's
Good.
good enough. That's good. That's good food for
That
me.
was not a question, but thank you. Okay, you've got some time off. Do you go on a beach vacation or a mountain retreat?
I like to go to a quiet location. Sometimes it could be my backyard where I will put my hammock and
Wow.
I'll have my reading book and I'll spend hours, reading in my quiet backyard. I love to read a lot.
So do you prefer that? Do you prefer staying at home in your environment? Are you comfortable enough that you wouldn't go on a beach vacation, but you'd rather stay?
I go on vacation every year a couple of times, but I enjoy staying at home the most.
Awesome. What's your go-to 5-minute stress reliever during a busy day?
Quick run outside.
A lot of people do that.
Yeah, and mostly because it is my me time. That time belongs to me, and yeah, so that's the best way to actually relieve
And
the stress.
it's easy. You just go.
Yeah.
You just leave.
I could be happy, I could be stressed, I could be angry, I could be depressed, and when I go out for a run, it just de-stresses everything.
And one last question. What's the best advice you were ever given?
Have been given?
Yes.
Well, my wife gives me advice every single day.
Okay.
I'm just trying to
Is
figure
there-
out what's
is there
the best,
one-
what's
is there
the
a
best
good
advice.
one?
Yes, the best advice.
Or something maybe
Yeah.
career related or life?
sometimes, my wife tells me it's okay to slow down. Because what happens, the work that we do, and it's not just with me, but I would say most of the healthcare professionals in the country, we are so driven by the passion, the mission, and we become singular focused towards that as well. So sometimes, it's good to actually take a break, pause, refresh yourself, and recharge yourself, and then go at it again. I think that's probably the best advice that I've been given, and I think there's some value in that.
Absolutely. Thank you. Thank you, Abhi Kalra, and say hi to your wife.
Thank you,
Thank you.
Christine, and thank you for the opportunity to have me here. I
My
enjoyed it.
pleasure.
Thank you.